I'm going to kick it over to Mike McLeod now, who's going to talk to us about what it's actually like, what a parent can expect who's engaging in a teletherapy session. He's going to speak specifically about speech. Hey, Mike.
Hey, how's it going? Thanks for having me. I appreciate it.
Yeah, thanks for being here.
Of course. So here we are. We're pretty much going on to, I've been doing teletherapy now, switched over for, this is probably my 6th week of teletherapy. I was very new to this. I'm much more used to doing face-to-face services through comp ed. I also have a private practice in Media, Pennsylvania, so outside of the city. So my entire career as a speech and language pathologist, I've done these face-to-face, intimate, one-on-one, and also group sessions. So this switch to teletherapy literally happened overnight, as I'm sure you guys all experienced as well, as this pandemic kind of hit us all at once. So my transition to teletherapy has certainly had its ups and downs. One of the best things about it was the SLP community and the American Speech and Hearing Association, ASHA, which is our credentialing agency, our governing body, put out a ton of great resources to teach us about teletherapy, to teach us about how to remain HIPAA compliant, to make sure that privacy is the number one issue that we're focusing on, and best ways to provide evidence-based practices through teletherapy, and make sure we're involving the parents and helping them. We're doing our counseling side of speech and language therapy. We're maintaining IEPs. We're doing everything that we're supposed to be doing. And we've done a great job. I think the speech and language community as a whole across the country has done an incredible job with this transition in terms of providing a valuable service to families, remaining in compliance, remaining HIPAA compliant, being in touch with families, making sure we're still providing a great service. Of course, I'm biased as a speech pathologist, but I think speech through teletherapy is one of the best services to do through Zoom or through Google Hangouts or whatever it may be. Joe spoke about possibly doing groups if your son or daughter has a social pragmatic disorder or social pragmatic goals. I think that's a very highly effective process. And so far, it's been an incredible experience. I've been able to include parents within my sessions more than ever before. I've been able to intimately go through IEPs, go through goals, go through data. It's so much more than just a progress note or a quarterly report that you may get. You're able to now bring the parents into the session for the last 10, 15 minutes, or maybe even the whole session, depending on the age, and bring them in and talk to them and get them involved. So teletherapy certainly has its great positives. This is like I said before, this is a situation that we've been thrust into very quickly. But in terms of speech and language goals and what you're always working towards, which is to improve overall quality of life, improve language skills, improve communication skills, I think we can really make some nice headway through teletherapy. And this is something that parents should certainly be pushing for from the IEPs, from their schools. It's, Zoom, getting a good HIPAA compliant version of Zoom is inexpensive, and you can make it happen. So it's definitely something that parents should be pushing for, because speech and language services, it's all about being within the natural environment. And sometimes, through the computer, when the kid's at home and you're at home, sometimes that's more natural than the speech room at a school. So I think there's many positives that we can come out of this. And it's definitely something, like Joe said, educate yourselves, go to the ASHA website. There's plenty of materials there. The educationlawyers.com, they put out some great materials for families. Just educate yourselves on what the services are available in your area, comp ed services, what is your school doing in terms of IEP compliance. Just kind of reach out and learn what's available in your area.
Cool. Mike, can you tell us what's it look like? So you sign on, you said you're using Zoom, but is the parent in the room? Are they not in the room? Can you just give us a little view of what a speech session would look like with you?
Yeah, absolutely. Yeah. So I like to use Zoom. I have the HIPAA compliant version of Zoom, which is fantastic. I have not had a single issue yet. You have to send a very unique link to the family. They'll attempt to join the session, and then myself as the speech pathologist, the host of the meeting, sees who is going to come on as a participant. So you see the list of names, people, you choose if you're going to admit them into the session or kick them out of the session. So you know it's going to, the privacy is of the utmost importance. Depending on IEP goals, depending on age. If it's a younger student, I love to have the parents in the session. If the parents are a distraction, it really depends on the individual family and the individual student. Sometimes kids are better with the parent not in the room. So it really depends on really what the parent wants and what's best for the child. But if you want to work one-on-one with the child without the parent, it's always best to bring the parents in for the last 5-10 minutes of the session. I think that just having that carryover, having that, really just making it an intimate experience, emailing the parents. One of the greatest benefits so far has been the carryover of like speech homework and speech assignments. Like say, for instance, the child has an articulation disorder. I've seen now more than ever before that child doing their speech homework, their speech practice in front of a mirror for 10-15 minutes a day on days when I don't have sessions more than ever before, because I have more FaceTime with the parents. I have a deeper relationship with the parents now, as opposed to phone calls and progress notes. So it's always great to get the parents involved any way you can.
So I do want to keep this positive because I think the more we like focus on the positive, the better, but let's be real. And what are some of the struggles you've seen, right? So it's not all great, I'm sure. Where are some of the struggles?
Well, of course, with anything online, you do, the obvious one would be, Wi-Fi interactions. Sometimes the Wi-Fi goes out. Sometimes there's lag between the videos. So that could be a real pain. Sometimes people have difficulty connecting their microphone, so you can't hear them for the first, until you teach them. Sometimes they can't get their video going. So there's a lot of difficulty. And if it's very, very young kids, because they're in their natural environment, it's hard to get them to kind of sit and relax, but and pay attention to the clinician, as opposed to being in a speech room where there's toys and you can do some floor time play. But yourself as the speech language pathologist, I've always taken it as it's our responsibility to get creative and to coach the parents and to teach them various ways to implement these speech and language strategies in the home. So if the kid is running around the room, what can I do as the SLP to direct the parent to elicit the language and elicit the goal? So there's always struggles. It's a learning curve, of course, outside of the technology. But as we're moving along here into the 5th, 6th week and into May, I think we can really start seeing way more benefits than struggles.
So 2 questions from the audience. Dina Kimball wants to know any advice on implementing a new AAC device.
Oh yeah, absolutely. So that's actually one of the things that I have seen incredible benefits in terms of teletherapy and AAC. AAC, there are so many ways to connect the AAC screen on the tablet to the computer. So that there's some great AAC information on YouTube. So if you type in AAC webinar, AAC teleconference, you're going to find some incredible information on how to do AAC in teletherapy. And when you can share the screen with Zoom, Google Hangouts, whatever it may be, you can have the entire screen of the AAC up on the computer, and it's totally interactive, totally intuitive. That's a really, really great thing to do. And the last thing I want to hear as an SLP is, oh, we'll wait until things get back to normal for us to start implementing this AAC device because it has to be face-to-face. Absolutely not. Get started right away. Do it through teletherapy. Find an SLP who has experience with AAC and knows how to implement it, can teach you parent strategies, and there's ways to do it through the computer. So this is a really good time to get started with a new device.
Perfect. That's good news. Another question from Cheryl Whalen. Can you give us the specific website for speech guidelines through the national organization?
Yes, that would be www.asha.org. So ASHA is the American Speech and Hearing Association. They are the governing body. So we have to be licensed through ASHA. So our credentials are always CCC SLP, which is the Certificate of Clinical Competence, which we receive from ASHA. So after we get our master's degree, we have to still go through a supervisory period through ASHA. So ASHA has all the information for SLPs. They do incredible work in terms of advocacy, in terms of family knowledge. So check them out. Feel free to reach out to them. They have a hotline. Ask them any questions. Yeah, they have a wealth of information.
All right, cool. Another question from Dean Gray. He wants to know, so I think this is going to kind of lead into another question I wanted to ask, but his question was, can the families get this HIPAA compliant service with Zoom using compensatory funds? So I think I hear his question. I think that you're the one who purchases the Zoom, right? And then the parents just log into your account. They just need a basic account. Is that right?
Yeah, I'm a private practitioner, so of course I took care of that myself on my end. If I was an SLP solely through a school, I believe it would be the school's responsibility to provide that HIPAA compliant technology. So that's an excellent question. That's definitely something to look into. But it really just depends on who the SLP is working for and where that technology is coming from.
Okay, so but with that question, I think what we really should know is whether you accept compensatory education funds.
Yes, I do.
So I think that as far as the Zoom goes, Dean Gray, I think that you shouldn't have to worry about that. I think the free software should be good enough for any family. Just like today, we have a special paid version of Zoom that's very secure and also allows hundreds of people in a webinar. So I don't think you have to worry about that. I think you should have to worry about, can you use the comp ed for services like Mike's, and can you?
Yes, I can. Yep, absolutely.
Okay, cool. And you said you're based in Philly. Where's the furthest you've taken an appointment? Anyone from Jersey or outside of the state?
I'm also licensed in Delaware and Maryland. I have a great network of SLPs that are also licensed in New Jersey. So it really just depends on where you're located and making sure that SLP is licensed in that state based on state licensing. But one of the great things about being in Philadelphia in this area is we have a great population of really highly trained speech pathologists here. So depending on your location and what your needs are, what specialty you need, I can easily make a referral to another speech pathologist who's credentialed through Philadelphia school board or whoever it may be. But yeah, I accept comp ed. I've done that for several years now. And there's many people who I'd be happy to provide a list or whatever it may be.
And while Dr. Campbell is going to get more into the evaluation end, can you give us a quick outlook as far as whether you've done any virtual or cyber evaluations at this point, or whether you'd be open to it?
I have not. I've not done that yet, but I am planning on doing that very soon, within the next couple of weeks. It's definitely going to be unique. There are many ways to conduct the tests through virtual. So once again, it falls on the shoulders of the clinician to get creative and find different ways to make it happen. Of course, within the evaluation, everything's going to be explained that this was done virtually. This was done through Zoom or Google Hangouts, whatever it may be. So it will be explicitly explained within the evaluation how the evaluation was conducted. And this should always be aware, depending on the dates and how it was done. But I know many clinicians who have done it and have had great success. I think we're very lucky to have this incredible technology and this video conferencing technology available to us during this difficult time. But yeah, it's something that if you need an evaluation done, I would certainly trust the clinicians and trust the process of it being done virtually.
And again, if you don't know, that's fine. We'll get into it with others. But do you know if any of the evaluations at this point are being like renormed or retooled or redesigned to meet virtual standards, which they should? I mean, it's inevitable. Are you aware of this being done yet?
Yes, I believe some of them. I believe that is being done. I believe that is being discussed. I think within the evaluation, I think as long as it's explicitly discussed that it was done, within the months of April, May, during the COVID-19 pandemic through Zoom. I think scores should be certainly normed a different way and explained in a different way. So I would not really worry too much about performance. I think really getting the evaluation done and getting a clear picture of how an IEP should be drawn up, what's happening in terms of comp ed. I think the results, the actual scores, I think getting an evaluation done and seeing really where your child's at overall is really what you should be looking for.
All right, cool. Mike McLeod, thanks. We'll have links to all these sites, but where can parents find you?
They can find me at grownowtherapy.com. I'm also on Instagram at grownowtherapy. You can email me at Mike, M-I-K-E, at grownowtherapy.com. So feel free to shoot me an email. Feel free to message me on Instagram, whatever it may be. I'll be happy to answer any questions. I know this is a really difficult time for families, but you know, just like Montgomery Law and everybody, I just try to be a great resource to anybody, answer questions, point them in the right direction, send them a great referral to someone in their area. Whatever I can do to help, I'll be happy to do it.
Yeah, and I can say that Mike's Instagram is great. That's GrowNow Therapy on Instagram, and he's constantly posting updates. So, thanks, Mike.